A breast cancer can present as a palpable abnormality in a symptomatic patient, but a lot of times it's totally asymptomatic where you cannot even feel a lump, and we see it on a screening mammogram. And how we see it on a screening mammogram is it's firstly could be a small mass, or it could be a subtle area of distortion, or an area of microcalcification. If it is a small cancer that we find on a screening mammogram, that has a lot of advantages to it being a palpable mass because you have better treatment options, less aggressive treatment options, and a higher chance at curable treatment. The benefit of a screening mammogram is that we have the ability, even when a mass is not palpable, to see an area of distortion, which we can see subtly on a 2D mammogram, but is better seen with our 3D imaging, where the area of distortion caused by the breast cancer is highlighted on the 3D mammogram. When we see an abnormality like this on the mammogram, we then do an ultrasound, and on ultrasound we have seen a mass in this case which measures 1.5 centimeter, and because we can see it on ultrasound, we can then do an ultrasound guided biopsy with a needle that takes a sample of the lesion on ultrasound. One of the other benefits of having a screening mammogram that can pick up a very early breast cancer is by us able to see microcalcification, which is a subtle area of calcification seen on this mammogram, where we can do magnification views and be able to see the calcification in more detail and characterize it and decide if it is something that we think is benign, meaning that it is not a cancer, or malignant, meaning that it is a very early cancer which has not broken through the ducts and has not spread through the rest of the body, but if left can actually become an invasive cancer and spread to involve the rest of the body. These cancers, because it's not a palpable abnormality, we do not usually see them on an ultrasound. The ultrasound findings are usually normal, so we have to biopsy them under the mammogram machine, so we call this a stereotactic biopsy. And this is the specimen that confirms that we have biopsied the area of the calcification. You can see the tiny little dots of calcification within our specimen, and that's how we find DCIS, which is a pre-invasive breast cancer, which would not be a palpable abnormality and is only seen on a screening mammogram.